Hello, and welcome to Northeast Georgia Medical Center's Joint Care Center education class. I'm Aileen Jackson, one of the orthopedic nurse navigators in the program. We are pleased that you have chosen Northeast Georgia Medical Center's Joint Care Center. Your decision to have joint replacement surgery is the first step toward a healthier lifestyle. Know that by choosing our program for your joint replacement, you are gaining a team of experts to help you before, during, and after surgery. This team consists of your surgeon, the orthopedic navigator, registered nurses in the hospital, physical therapist, and occupational therapist. During this class, we will cover the topics you see listed on this slide. Our goal is to ensure that you are as prepared for your surgery and recovery as possible. Joint disease is the most common cause for disability in the U.S. There are two primary types of joint disease, osteoarthritis and rheumatoid arthritis. These types of arthritis cause pain, swelling, and loss of motion, all of which cause patients to seek treatment from an orthopedic surgeon for relief. These pictures show the damage that osteoarthritis can cause to your knee. The picture on the left shows a healthy knee, and the picture on the right shows a knee that is affected by osteoarthritis. Notice the cloudy area? This is inflammation and irritation caused by bone-on-bone friction. On this slide, you see the different components of the knee replacement. Notice that areas on both the femur, or the thigh bone, and the tibia, or the shin bone, are replaced. For those patients having a hip replacement, this slide shows a healthy hip on the left and on the right, a hip damaged by arthritis. Again, you can see the white cloudy area of irritation and inflammation. Here, you see the components of the hip replacement. Both areas of the hip joint, the ball or the top of the femur, and the socket area in the pelvis are replaced. Now, let's move on to how you should prepare for surgery. After surgery, you are not 100% steady while standing and walking. Due to this, you will need assistive devices to ensure your safety and prevent falls. We recommend the use of a rolling walker. A rolling walker has 2 wheels in the front and 2 straight legs in the back. An example of a rolling walker is pictured on the left of this slide. Please note, we do not recommend any type of walker that has more than 2 wheels. Rolling walkers are covered by insurance and can be ordered for you while you are in the hospital. If you need these items ordered, please discuss this with your orthopedic navigator. Another assistive device is a bedside commode. Do not let the name fool you. A bedside commode has multiple uses and you will be able to walk to your bathroom. A bedside commode is pictured at the top of the slide. The bedside commode can be used as a frame that is placed over the toilet to make it taller, as well as provide handles for you to use to push off of to stand. The commode can also be used as a shower chair in a walk-in shower. There are other assistive devices such as toilet risers and shower seats that you can purchase prior to your surgery to ensure your safety moving around your home. If you already have safety equipment at home or plan to borrow a friend's, please be sure that it meets the guidelines we recommend for assisted devices. A hip kit is another assisted device that can be useful after surgery. The tools included in a hip kit are a long-handled shoehorn, a reacher, and a sock aid. The devices are made to assist you in your self-care, such as bathing and dressing. Unfortunately, insurance does not cover the purchase of a hip kit after surgery. If you feel you would benefit from the hip kit, you can purchase one online or from different area pharmacies. Infection prevention methods used before surgery reduces the risk of developing an infection after surgery. The first intervention you will be asked to do is to decrease the bacteria that you carry in your nose. After surgery, when your body is weakened, the bacteria you naturally carry in your nose could potentially cause an infection in your body. To decrease the bacteria in your nose, you'll be provided with a prescription from your surgeon for mupirocin ointment. This ointment is placed inside the nose twice a day for 5 days prior to surgery, and this will decrease the natural bacteria that could put you at risk. An additional infection prevention method is cleaning your skin. Cleaning your skin properly with the use of chlorhexidine gluconate soap and wipes reduces the amount of bacteria on your skin. This then decreases the risk for infection in your surgical incision. An example of chlorhexidine soap is Hibiclens. Hibiclens can be found at your local pharmacy. You will be asked to bathe with Hibiclens soap for 5 days prior to surgery. The use of Hibiclens over 5 days provides extended antimicrobial protection on your skin. You will also be provided with chlorhexidine gluconate wipes that you will be instructed to use the night before surgery. By following this skin cleansing routine and using mupirocin ointment in the nose, you are reducing your risk for infection after surgery. We want you to be sure that you heal well after surgery and help prevent avoidable complications such as an infection. We will have a physical therapist come in and demonstrate some of the exercises for you to enhance your understanding of how to perform them. We want you to begin doing these exercises now. The stronger you are going into surgery, the better your chances of having a smooth and quick recovery. These same exercises will be used for therapy immediately following your surgery. All of the exercises we are going to cover should be done in sets of 10, 3 times a day. A good way to remember is morning, noon, and night. You want to complete the exercises on the side you're having surgery, but you can do both legs if you would like. If any of the exercises irritate your joint or cause pain, please stop and try again in a day or two. Ankle pumps. This exercise is simple and involves flexing and pointing your toes. This exercise is to help increase the blood flow in your legs. Quad sets. This exercise is to help strengthen your thigh muscles. You will do this by lying on your back with your legs straight out in front of you. You will then press your knee down into the bed, tightening your thigh muscle. Hold this for 5 seconds and then release. Don't forget to breathe through the exercise. Gluteal sets, or bottom squeezes. You can do this one sitting or lying. You're going to squeeze your bottom together, hold it for 5 seconds, and then relax. This exercise helps with circulation as well. Hip abduction and adduction. Imagine you're making a snow angel. You're going to lie on your back with your legs extended and your toes pointing to the ceiling. You then slide your leg to the side and then back to the starting position. Do not pick your leg up and move it out. Be sure to slide it along the surface you are lying on. Heel slides. This exercise bends the knee and can be difficult immediately after knee surgery. Hang in there as the exercises will get easier each time you do them. Lying on your back, slide your heel along the surface of the bed while bending your knee. You may use a strap to help you bend immediately after surgery. You can discuss this with your therapist. A short arc quad. For this exercise, you will need to place a rolled up towel underneath your knee. This is the only time we will want you to place anything under your knee. Once the towel is in place, you will lift your foot from the surface of the bed, straightening the knee as much as possible. Do not raise your thigh off the towel roll. Just raise the lower portion of the leg and then slowly let it back down. Straight leg raises. These exercises can be difficult for both knee and hip replacements after surgery. For this exercise, you will lie on your back with your non-surgical leg bent at the knee and your foot flat on the bed. Next, you will tighten your quad on your surgical leg, holding the leg straight. Then you lift the leg about 12 inches off the surface you are lying on. There's no benefit of raising your leg any higher than 12 inches or the height of your bent knee. Be sure to keep your knee straight and your toes pointed up. Long arc knee extension. This exercise is like the short arc quad we discussed earlier, only you're kicking the leg up higher. For this exercise, you will need to sit in a chair with your back against the chair and your thighs fully supported by the seat of the chair. Next, you're going to lift your affected foot up, straightening the knee. Hold this for about 5 seconds and then slowly lower the leg down. Although you're having surgery on your leg, it's important to strengthen your arms as well. This is important because you're going to be relying on your arms to help support your weight until your leg is strong enough to support you. Armchair push-ups. For this exercise, you will need to be sitting in a sturdy chair that has armrest. You will place your feet flat on the ground and your hands on the armrest. Straighten your arms while raising your bottom up from the seat as far as possible. If you need to use your legs to help lift you up, that is fine. As you get stronger, progress to only using your arms and non-surgical leg to perform the push-up. Next, we will discuss seated knee flexion. This exercise is for knee replacement patients only. To perform the exercise, you'll need to sit in a straight back chair that is open on the bottom. While seated, bend the affected leg back as far as possible under the chair. When you reach your maximum bend, plant your foot and slide your hips forward to further bend the knee. Hold this for about 20 to 30 seconds, then sit back, resting for a minute. When sliding forward, be sure not to slide out of the chair. Now we will cover how to be successful after surgery. Proper planning prior to surgery can help with a smooth hospital stay and transition home. Prior to your discharge from the hospital, you will have spoken to your ortho navigator to confirm that your physical therapy is set to begin a few days after you leave. Also, the ortho navigator will work closely with the case manager to arrange any needed assisted devices to be ordered and delivered to you prior to leaving the hospital. Prior to surgery, arrange for help at home. It is best to have help at home for the first few days to weeks, depending on how you are doing. Also arrange to have someone drive you home from the hospital. Once you arrive home, be aware of any floor hazards that could potentially trip and cause you to fall. It is very important to avoid falls by using your assisted device and having help at home. Pain control is a big concern for many patients. Keep in mind that your surgeon uses a combination of medications to ensure your pain is manageable. Remember that pain medication cannot take all the pain away, but make it tolerable to where we can participate in therapy and walking around. Most surgeons use nerve blocks to help decrease pain. These blocks can last anywhere from a few hours to a day or two, depending on the patient. Sometimes a pain block does not control all the pain. You will be provided with pain medication to go home with. Be sure to follow the directions on your pain medication closely. Take the pain medication if you need it. That is what it's there for. Often we see patients that are concerned about taking prescription pain medicine. This is understandable. Be aware that you'll only be taking the medication for a short period of time. The surgeons are only allowed to give you a 1-week prescription at a time. If you feel you need a refill, that's fine. Just contact your surgeon's office directly for the refill. When it comes to side effects from pain medications, the common complaints are nausea and constipation. To avoid nausea, be sure to take the medication with food. Avoiding constipation can be a bit more difficult. Do not go more than 2 to 3 days without having a bowel movement. Making sure you're taking in plenty of fluids and high-fiber foods can help deter constipation. If this does not work, a stool softener or laxative of your choice is appropriate to take. Lastly, do not drive while you're taking prescription pain medication. When you are able to drive is determined by how well you are doing in therapy and your surgeon's approval. There is a potential for you to develop pneumonia after having surgery, anesthesia, and taking pain medication. All of these factors decrease how deeply you are breathing. To help with this, we will have you do breathing exercises after surgery and continue this while you're at home. To perform the exercise, you need to take a deep breath in and hold it for about 5 to 10 seconds. You will then breathe out slowly like you're blowing out candles on a cake. This exercise helps to open the lungs and prevent pneumonia. It is best to take deep breaths 10 times every hour you are awake. You'll be provided with an incentive spirometer device to help you perform this exercise. The proper nutrition after surgery can promote better healing. Eating fruits and vegetables high in fiber helps to reduce constipation and promote wound healing. Additionally, taking in plenty of fluids and water helps to keep you hydrated, regulates your blood pressure, and flushes out any toxins in your system. Often we hear that a patient does not have a great appetite after surgery. This is okay, and your appetite will return to normal in a few days. If you find you are not wanting to eat a meal, try a protein shake or bar to help get in your nutrition. Sticking to your normal daily routine after surgery helps you feel better. Remember, you're not sick. Your attitude and commitment to your rehab after surgery will determine your outcomes. Patients that follow through with their therapy and attend follow-up visits do better in the long run. Every day you should get up and get dressed, be out of the bed, and sitting up for meals, doing your exercises, and walking. Healing does not happen overnight after a joint replacement. Look out for small improvements in your mobility and how you're doing your exercises. Keep in mind, healing after a joint replacement is a marathon, not a sprint. You have access to your surgeon's office anytime you have questions or concerns. If you experience a fever above 102 degrees, pain not relieved by your medication, excessive swelling in your legs, redness or drainage from your incision, or constant nausea, vomiting, or diarrhea, please reach out to your surgeon's office immediately. Do not wait for your next appointment. In closing, I would like to remind you to be sure to read your guidebook, schedule any pre-surgery testing or clearance appointments needed, prepare your home, plan transportation, and help for after surgery. If you have any questions regarding this presentation, contact your orthopedic navigator at the numbers listed in your guidebook, as well as on this slide or your surgeon's office. An easy way to contact your surgeon is through MyChart. MyChart is an online patient portal where you can communicate easily with your doctors, access appointments, test results, and request prescriptions refills. From all of us at the Joint Care Center, we thank you for watching this informational video. I hope you found it helpful.